Good commercial, G.S. Regan. Good commercial. All right, so in that commercial, I did state long-term care. So please, if you have enough money and you can afford it, please get the long-term care activities of daily living. And then, unfortunately, you do go into the final hospice, end-of-life topic. So we have Wayne Arthur Regan, Wayne A. Regan, in the studio today. 757-1320. If you have any questions, 203-757-1320. I know it's a tough topic to talk about, but when you do have an expert, let's utilize them. Okay, so my first question to the expert is, I sell Medicare supplements and I sell Medicare Advantages. A Medicare supplement, you keep and retain original Medicare, and with a Medicare Advantage, you give up original Medicare and you go on a managed care. What's the difference as far as hospice is concerned with that?
Hospice is covered through both Medicare and Medicare Advantage plans, which is nice. As I mentioned, they will cover the medications that are associated with the disease that's the hospice diagnosis. They'll cover durable medical equipment if needed, which means like a bed tray or a bed or a walker or a cane if needed. 94% of hospice care is covered by Medicare. The other 6% is third-party insurances such as Blue Cross Blue Shield, Anthem, Aetna, and they do cover the hospice benefit as well.
Yeah, we also have a carrier in Connecticut called Connecticut that does cover it as well. As far as the durable medical equipment, someone needs a walker. Lisa and I constantly are getting asked at the office, how much is it going to cover? They really only cover percentage. They don't cover 100%. Is there a way that the case manager can code it, CPT code it, so you get more covered, or is it's just hospice has general guidelines?
Hospice has its guidelines, but it is a covered benefit through hospice. So if you weren't on hospice, there may be a copay associated with it. But in hospice, it's a covered benefit.
And then they take their DME equipment back, or you retain it?
They take it back. So typically, we'll see patients, and that you'll work through your physician, through the discharge planning departments of a hospital, and that's typically where we'll see a liaison in a hospital will say, maybe you should talk to the hospice about hospice care, and your physician may make that referral. But a referral has to be signed by a physician, and that referral is then made to a hospice. There are, as I said, 6,100 hospices throughout the country. In Connecticut, there are plenty of not-for-profit, there are for-profit, and you can provide hospice care in multiple settings. Most of hospice care is what we call routine. There is then continuous home care, there's respite hospice care, and there's general inpatient. General inpatient is usually for those acute or complex symptom management stays, and it's in the hospital setting or in a hospice residence that does that.
And the hospice resident, that's a separate building, not a hospital. It's actually a separate residential living facility?
Correct. And in the hospital, they may have a hospice unit.
A unit or a wing.
And I know in Waterbury there.
I was blown away. The hospice facility obviously follows up with the family for a period of 13 months after?
13 months, yeah.
So they just counsel, what's
it's part of their responsibility as part of their bereavement program to follow up on a monthly basis with families. And it's a great way for families to continue to talk about death and dying and deal with their own emotions on dealing with the loss of a loved one. That they also do a lot of memoriams and services that can help all that were associated with hospice and healing. And there's a couple other tools that are out there. One is called the Conversation Project, which is Ellen Goodman, who's a writer out of Boston, has, and it's online, and it's a great tool to have that difficult conversation. And there's another one called Honoring Choices. So those are tools that you can utilize as a family to talk about how, what, why, and it helps you make those difficult decisions so you don't have to do it in the catastrophic time that typically occurs when someone's in the hospital, and then you have to decide, oh my God, what do we do now?
That's why I'm trying to announce it on the airwaves now. You and your beautiful wife are in a situation right now with your mother-in-law where you have to have that conversation.
Yeah, we already have, and we have a plan of what's going to occur with my mother-in-law and as she declines, and she's got some serious dementia, which is a very difficult disease to deal with, and we've done all we can to keep her in our own home, and now she's in a memory unit in assisted living, and at some point she's going to decline even more. So we know that the next step will then be a nursing home,
right.
And if she doesn't have to go to nursing, we're trying not to do that. But we all have these difficult decisions.
You and I are going to have the conversation ourselves with our father. Yep. Every time I bring it up with him, he's like, we're not talking about that. No,
he doesn't like it.
Different is it when you're on Medicaid versus on Medicare?
State of Connecticut still covers the hospice benefit through Medicaid.
God bless Connecticut, huh?
Yeah. Most states do. Actually, there's 45 states that now cover hospice benefit. They've all moved in that direction. But
because it's the right way to treat people. Is that what you're basically saying?
It's a benefit that's covered. It's through the Centers of Medicare and Medicaid. That's so because of Medicare. Now remember, Medicare, the federal government will pick up half that benefit, and state has to pick up the other half.
Title 19, sure. I do that a lot, actually. A client of mine called, no name for HIPAA, but the skilled nursing facility called yesterday and said, I see that you got that person the Medicaid benefit. I said, well, you're the one who took her off. I had a client on last week. The skilled nursing facility now is actually taking people off managed care, getting them back to original Medicare and getting them the Medicaid, because I guess she was trying to explain that the Medicaid benefit through hospice is better through the Medicaid than it is normal Medicare. I mean, that's amazing.
It covers the room and board.
Right.
That's the issue.
It'll pay for it, huh?
It's the room and
instead
board
of the $160 a day or whatever the fee is.
Exactly.
All right. So